we don't really have broad consensus in the field about when in the course of a patient's care we should be taking these CSF samples for liquid biopsy. And part of that is also because we don't have widely agreed upon standards for how to collect these samples in a uniform way, how to process them in a uniform way, if you're going to store them or ship them, how do all of those variables, all of those factors ultimately impact the performance of the downstream assay of interest. And so you can imagine that if there are multiple institutions or multiple companies trying to develop these assays and people aren't really following the same guidelines or playing by the same rules, it could end up being pretty confusing down the line in terms of how to interpret the results of some of these assays. So this paper was the result of a broad effort across the field to try to bring experts together from both academia and industry and try to agree upon consensus guidelines for which pre-analytical variables we should be paying attention to when doing research in CSF liquid biopsy. And pre-analytical variables are essentially any factors, before the assay is run on the spinal fluid sample that could ultimately impact the performance of that assay. So again, these are things like, how did you collect the sample? Was that done through a reservoir, a spinal fluid reservoir, like an Ommaya reservoir, or was it done through a lumbar puncture spinal tap? Was it drawn intraoperatively during a brain tumor resection? That's one example. There are others, including, again, how do you process the sample once it's collected? What sort of tube do you put it in? What temperature do you store it at? So through a 2-year process of many meetings, many discussions, thorough review of the literature, we were able to come up with a list of what we consider to be the key and most critical variables that researchers in this field should be collecting and reporting for CSF liquid biopsy studies.